Hello, my name is Courtney Matheny. Today in my audience I have Mr. Stanley Perkins and Mrs. Wanda Phillips. Today I have some handouts for you guys to kind of follow along. Almost 90% of people who suffer from out-of-hospital cardiac arrest die. Their chances of survival are doubled and even tripled if they receive CPR within the first few minutes. 70% of out-of-hospital cardiac arrest happens at home. What does this mean to you? This means that if you ever have to perform CPR, most likely you'll be trying to save the life of somebody you love. You don't want to be sitting there unable to do anything waiting on somebody else. According to the American Heart Association, only 46% of people who suffer from out-of-hospital cardiac arrest receive immediate help before professionals arrive. CPR saves lives. With that being said, it's advantageous of you to learn how to perform CPR. So let's start. What's the first thing you should do? You should start by assessing the situation. You can do this by tapping the victim to see if they're conscious. Then you'll want to check their pulse. The next thing you'll want to do is listen for respirations. If none of these things are present, you need to call 911 immediately. If someone else is with you, instruct him or her to call 911 and you start CPR immediately. If you're by yourself, you call 911 and thereafter start CPR. So once you have established that CPR is necessary, you'll want to start by giving rescue breaths. If you have a CPR mask, you start by taking the pointed end and putting it over the victim's nose. Then you'll want to make sure the mask completely covers the mouth of the victim. You'll give a full entire breath and watch the chest rise and fall, like so. You can see in this illustration that they're using a mask in order to give CPR. If you don't have a mask, it's okay. You can still do CPR, like in this picture here. You will pinch the bridge of the nose and make sure that your mouth completely encompasses the victim's mouth. And you'll want to make sure you keep it tight and sealed so that they're getting the maximum amount of air. Now, as shown over here, you'll want to keep the head tilted in order to create an open passage. Once you give one rescue breath and you watch the chest rise and fall, then you give a second rescue breath. After this is completed, then you'll move on to chest compressions. Chest compressions start by using the heel of your hand and placing it in the middle of the victim's sternum. You'll then take your second hand and place it on top of your first hand, making sure that your fingers are intertwined in your other hand. Then you'll push on the victim's chest about 1.5 to 2 inches. You can see this in this illustration, and as it's showing, you're literally pumping the victim's heart for them. In this illustration, you can kind of see the way you should have your posture and how far you should be pushing on the victim in order to protect yourself and to protect them. So you need to do about 100 compressions per minute. This rhythm can be attained by singing the song Staying Alive. This will allow you to achieve the correct rhythm in which you would do 30 compressions for every 2 rescue breaths. You'll continue to repeat this process for 2 minutes. After the first 2 minutes, you'll then recheck the vital signs. If nothing has changed, continue doing CPR. You will continue to do CPR until help has arrived. You never stop doing CPR. So remember, keep in mind ABC: airway, breathing, circulation. So with that being said, you assess the situation, you do rescue breaths, and then chest compressions, and you don't stop until help arrives. Wouldn't it be awesome if more than 46% of the population could help save their loved ones? Now that you have the information and the power, you can potentially save one of your loved ones.